my name is Pureza. I'm in Rebecca Bowman's class, Adult Health 1 at the CJ Nursing. We're going to be doing a medication via piggyback. Some of the items we're going to be using that we'll get ready before we go into the patient's room is get our small IV tubing, the shorter one. You're going to get, regarding the medication, whether it's 50 mLs or 100 mLs, you're going to check which one your medication needs to be mixed in. You're going to grab the saline bag, a pair of gloves, alcohol swabs, and the 10 cc syringe. You're going to need one to drop your medication. You're going to need one to flush the normal saline. So I'm going to review my information on my drug card that's on the MAR that's been ordered for the patient. Vancomycin has been ordered at 500 milligrams over 6 hours. So for it to run at 6 hours for the 10 drop set, it's going to run approximately 14 drops a minute. I'm going to go into my patient's room and I'm going to ask the patient if they have any allergies, any known allergies to them, medication, to For this particular instance, patient has no allergies. The primary line is already running at a TKO rate to keep the vein open. And we're going to go ahead and I'm going to let them know that they have been ordered based on my values. They have a high white blood cell count. Doctor has ordered vancomycin, and it is a bactericidal action. Take my alcohol swab, clean the top of my saline. Take another alcohol swab, and I'm going to clean my medication bottle. I'm going to hang my saline up here, and I'm going to prepare my label. I like to go ahead and do that first so I don't forget. So I'm going to do the date. We're going to put 500 milligrams of vancomycin. So we know which drug is in the bag and the time that we're going to start this. And then my initials. And we're going to do in the left and the patient's right forearm piggyback. I'm going to label the back of my bag so that everyone can see what medication is in the bag. I'm going to wash my hands. And I'm going to go ahead and apply my gloves. Okay, so we've already calculated our doses. We've determined that 500 milligrams will be given over 6 hours with the 10 drop set, which gives us approximately 14 drops a minute. So, you're going to notice that we have 2 ports here. One is for the medication, and one is for the fluid.
Expires in June of 2015, so
this is sterile.
So yeah.
On the bottom, you'll notice that you have a little cap covering on the end to maintain sterility.
Well, anyway, we're just going to say.
Now we're going to draw up the vancomycin first. I'm going to drop the amount of air that you're going to draw up in medication. I'm going to inject 10 mLs of air into the vial, and then we're going to aspirate the 10 mLs of vancomycin.
What? You want to try this?
After we've done that, we're going to recap the CNL for school resource purposes. And then we're going to bring down the medication bag. This is the port where it's going to go into. We're going to clean that with alcohol swab. And then we're going to take our syringe with vancomycin and we're going to inject it into this port. Now I'm going to bring the fluids down towards the valve to maintain.
No, this is the wrong side.
We're going to hold it, inject in, being careful not to puncture the bag. And we're going to slowly add in your vancomycin.
All right, so now that's ready?
Once we've done that,
All right, so I got my
I'm going to
target.
quickly recap this needle.
All right, let's do this. What do you want? It's like a comic that I like on his own.
And we're going to slightly invert to make sure that the medication is mixed well. In the meantime, we're going to tell our patient that the medication is to kill off any infections. They have elevated white blood cell count. This is the medication that was ordered by the physician to treat their condition. We're going to let them know that there is side effects: nausea, vomiting, hypotension, low blood pressure, nephrotoxicity, hearing. It can affect their hearing. So if they notice any of these, they can let us know. Now, in order for the piggyback to be successful, your primary line needs to be below the piggyback. So we're going to use this little nifty hook and hang it over here to where it's below and our piggyback's above it. So gravity is working for us and we'll infuse into the patient. Now I'm going to go ahead and check the line on the patient. So I'm going to check and see if there's any reddening, any swelling around the area. Make sure that the placement of the INT is still good. That the fluids are infusing. There's no pain to the site. There's no swelling, no blanching, no paleness, no hematomas. Everything is good. I'm going to take my syringe and we're going to drop some. I'm going to drop some saline. My alcohol pad and clean the bottle. I'm going to inject the same amount of air that I'm going to withdraw on saline. And then we're going to invert the bottle. Draw out the saline.
It's a full-time job for a woman.
Okay. Once we've assessed the site and know that nothing else is going on, we're going to take our alcohol and we're going to come over here to the closest port and we're going to clean that off. Basically, I'm going to insert my saline syringe into the line. I'm going to slowly aspirate, make sure that I see venous blood return, ensuring that I'm still in the vein, and then I'm going to do the slow pushback method back into the vein, making sure that our line is good. It's another little checks and balances. Once I've done that, I'm going to go ahead and connect my piggyback tubing. Okay. So we're going to take off the blue port on our bag. And then we'll be connected. Okay, so we're basically going to take this off. We're going to take that. And we're going to invert, slightly twisting. Hang this up here. Again, this one has to be higher than your primary tubing. I'm going to open the chamber, allowing the fluids, priming the chamber halfway, allowing the fluids to drain to the bottom. And then we're going to close the chamber. Once we prime the line to the end, we're going to assess which port we're going to go into. So we're going to go up here to any of the ports that work. We're going to take port
I'll suddenly just stop.
Take our alcohol wipe, clean it. We're gonna take the cap off, not touching the inside of this one. You push and twist and make sure it's secure, and then we're gonna open the line. As you can see, it's open. And it's dripping about 14 drops a minute. We're going to make sure that it's coming out good, everything's flowing. If this one shuts off, it's fine.
Alright, so.
No problem. Once the IV finishes, the primary bag will normally start
Alright, are you ready?
flowing in just at the rate that it was prior to. Okay. Okay. We're going to continue to observe the infusion, giving the patient a few minutes, making sure that they don't feel any pain, burning sensation, have any problem with the piggyback. Once we've done that, then we can.
No. Alright. I need to pop off that.
We just double check, make sure your flow rate's good. Okay. We're just going to continue to observe the infusion periodically and make sure that everything's okay. And check back with the patient on their side effects. See if they're feeling anything, have any. If not, then we're good to go. We're going to dispose of all of our needles in a sharp container. And we're going to clean up our area. Now, once the infusion is done, this, unless we're going to change it, we can actually leave this because it's a closed needleless system. So, assuming that our piggyback is finished, this is fine. The primary will start infusing. You can come back and just recheck the rate. And if there's no problem with the site, everything's fine. If you need to disconnect this for any reason, you want to replace the alligator clamp or put on a new lure lock and just drape it over the pole, just to maintain sterility. Now, double check that your medication is labeled, and then we're going to label date and time, initials on the tubing too. And put that on the tubing. And that completes. Before we complete, we're going to double check. Make sure you document everything that you did, how the patient tolerated the procedure, in the MAR. Make sure that medication administration was documented, right med, right dose, right route. And then that completes our piggyback.